How's your morning cigarette, Otto?
Well, it almost tastes as good as my morning beer.
Nothing like a morning beer with a carb-loaded donut.
Excuse me, miss. Can we please get some insulin for the table?
Insulin? Have you two boys ever heard of metformin?
Metformin? What's that?
Metformin, or glucophage, is an oral anti-diabetic drug or biguanide used to reduce glucose levels in type 2 diabetes.
Oh, yeah?
Mm-hmm.
The way it works is to promote the storage of glucose as glycogen in the liver, which reduces glucose production.
I don't know if I understand this fancy lingo. Could you just tell me or us what we need to know?
Yes.
Nursing considerations. Never be given to a patient with impairments of renal system or hepatic system failure. Give metformin tablets with food, reduce GI reactions. Do not crush. Monitor the patient's blood glucose levels and alert women of childbearing age that metformin may cause ovulation in some premenopausal women, which may lead to unintended pregnancies.
Are either of you two boys expecting?
Has my beer belly gotten that bad? Maybe I should take control of my health and my diabetes.
That is great, but there are some side effects that you should be aware of.
Side effects.
Side effects of this medication are diarrhea,
I think I'm having some issues with this metformin. I can't hold it.
metallic taste, upper respiratory infection, fluid retention, dysuria, headache disorder, nausea, vomiting, flatulence, vitamin B12 deficiencies, abdominal distension, and weight loss.
I don't know about this metformin. Black box. Risk for lactic acidosis is increased in patients with renal insufficiency or any condition that puts them at risk of lactic acid production, such as liver disease, severe infection, excessive alcohol intake, shock, and hypoxemia.
I don't know about that alcohol one.
I don't think we can do that.
So, miss, how do we know if we can take this drug or if it's right for us?
Well, there are some contraindications and drug interactions that you should know of.
Adverse drug reactions: hypoglycemia, hepatic injury, aplastic anemia, thrombocytopenia, lactic acidosis. Drug-drug interactions: calcium channel blockers, corticosteroids, estrogens, thiazides, nicotinic acid, oral contraceptives, phenothiazines, phentoins, sympathomimetics, thiazide, and other diuretics. Thyroid drugs, possibly causing hyperglycemia. Catotonic drugs, nifedipine, vantanib, possibly increased metformin level and possibly increased risk of lactic acidosis. Insulin and sulfonylureas increased risk of hypoglycemia.
Well, heck, I sound like the perfect candidate. How much do I take?
It's an oral medication, and the starting dose is 500 milligrams twice a day or 850 milligrams once daily. Then the dose is increased to 1,000 to 2,550 milligrams in divided doses per day. If you take Fortimint, the recommended dose is 1,000 milligrams once daily.
Sounds pretty good. Brand names.
Brandy. I like brandy.
No, it says brand names.
Oh. Formet,
Metformin,
glucophage,
Glucophage XR,
flumetizer,
Glycon,
nova metformin.
Real Met. Now that I got my diabetes under control, I've never felt better.
My A1C is never been better.
And don't forget about lowering triglycerides and our cholesterol.